Heart attack essentially is permanent damage to the heart muscle. It is also called myocardial infarction. It's when a part of the heart muscle becomes irreversibly damaged. Heart attack can be due to many causes, but the most common cause is due to blockages in the blood vessels in the heart. So we all know that heart muscles require oxygen-carrying blood to supply it to nourish the heart muscle. However, when the blood supply is compromised due to blockages in blood vessels that supply the heart muscle, then it can cause a heart attack. Over time, sometimes what happens is that you can get cholesterol material, fatty material, inflammatory cells, smooth muscle cells, or other kind of material that built up within the walls of the blood vessel. When this happens, you form a plaque. These plaques will obstruct the flow of blood through the coronary arteries and compromise the blood supply to the heart muscle. Sometimes these plaques can, for whatever reason, crack open. When that happens, platelet factors, which are components in our blood supply that forms clot, they can clump onto these plaques, and this results in a blood clot that blocks off the whole entire blood supply. Heart muscles don't get blood supply, then they become damaged. Sometimes it can be precipitated by stuttering symptoms such as chest discomfort, breathlessness, or dizziness, or patients may feel that over a course of several days, whenever they walk a little or do a bit of exertional activity, they experience heaviness or tightness across your chest. But there are also some patients who may get heart attacks suddenly where there's no warning symptoms. First of all, when we have a heart attack, we have to get medical attention, and the paramedical staff or the medical treating physician will have to do a series of tests to determine if the patient has heart attack. The initial investigations will include an electrocardiogram known as the ECG, where they attach several stickers onto the chest of the patient to record an electrical rhythm. That rhythm will be able to tell us what is the heart rate as well as the damage of as well as possible damage to the heart muscle. This will be followed by confirmatory blood tests, where the doctors will take a blood sample to look for cardiac enzymes as well as cardiac troponins. These are proteins that are released into the body when the heart muscle becomes damaged. Also, they can also do an echocardiogram. This is an ultrasound imaging scan of the heart, and we can determine whether the heart is still pumping normally or a certain part of the heart muscle is damaged and is not moving well. And finally, for a definite evaluation of a blocked blood vessel, patients will have to go for a cardiac catheterization, or also known as coronary angiogram. This is an invasive test where a small tube about 2 millimeters is inserted in the body, either through the wrist or through an artery in the groin. And then under X-ray guidance, the doctor will inject a small contrast material that will delineate the outline of the blood vessel, and they can determine if there are any blockages within the blood vessel. All patients with heart attack, as I mentioned, must be treated as early as possible to minimize the damage of the heart muscle as well as to increase the chance of survival. Treatment starts with medication, and these medication will include aspirin, which is a good antiplatelet agent to reduce the clotting tendency in the heart. And the patients will also be given another antiplatelet agent, usually either what we call prasugrel, Plavix, or Brilinta. And these are medications that will help dissolve the blood clot to a certain extent. In some hospitals, patients may be given an infusion of medication called a clot buster to try to dissolve away the clot. And more recently, most patients in certain in developed countries will go to a hospital where they will undergo an urgent coronary angiogram. And that can be known by a variety of terms. It includes percutaneous coronary intervention, coronary angioplasty, or coronary stenting. They essentially refer to the same process of trying to unblock the blood vessel in the heart. The doctors may be able to try to unblock the artery by using a balloon to stretch open a blood vessel and putting a metal stent as a scaffolding to prop open the blockage. However, in some individuals where they find that perhaps a blockage is in a very severe location and compromise several major arteries, they may even have to consider early coronary artery bypass grafting surgery, and that would be an open heart surgery. Firstly, we have to recognize that heart attack is a very dangerous condition, and it does claim the lives of many patients who present with heart attack. So even before arriving at hospital, perhaps a quarter of patients may actually die from a heart attack. And the early treatments such as coronary angioplasty, there's still a risk of about 5 to 10% risk of early mortality, heart failure, recurrent dangerous heart rhythm, or even a small risk of stroke. And if they have a massive heart attack, and if they undergo surgery, the risk will certainly be high for recurrent events. When you have a heart attack, because some part of the heart muscle is damaged, then the electrical stability in the heart becomes compromised, and then the heart attack actually generates arrhythmia or dangerous rhythms such as ventricular tachycardia, and that can cause death at that point in time. So heart attack can cause arrhythmia. I think we do have to recognize that after a heart attack, some portion of the heart muscle will be damaged, and that damage or inflammatory process may go on for several weeks, up to 2 months, because the heart muscle completely healed. So in the first 1 to 2 months, I think there will be more critical period, and we will usually advise patients to take things easily. In terms of medication, it's very important for them to be on medication to prevent further heart attack, such as aspirin and other antiplatelet therapy. They should be on a cholesterol-lowering medicine, usually called a statin, that will try to stabilize the cholesterol plaque within the blood vessel. And they will also be placed on other kind of medication that will try to reduce the workload of the heart or reduce the blood pressure so that the heart will not be excessively be stressed or strained. And if possible, patients should also undergo a period of or undergo a rehabilitation program, such as what we call a cardiac rehabilitation program, where a combination of physiotherapists, occupational therapists, and nurses can advise patients on what kind of activity, exercise, or that they require, or what other dietary measures and lifestyle changes that they should adopt to try to minimize the risk of a recurrent heart attack. Heart attack is due to coronary artery disease, and we always recognize that we don't completely treat or cure a patient of coronary artery disease, but we actually reduce their risk of future events. So it is up to a patient to try to make lifestyle changes to minimize a further heart attack. So to do that, we want to control the blood pressure. So taking a lower salt diet, or to reduce the amount of salt in our food, in our drinks, or other kinds of things that we consume, will reduce the blood pressure, and that will reduce the workload for the heart. Similarly, it's very important to reduce the dietary oil or saturated fat intake, and this will include, let's say, reducing our consumption of fried food, or perhaps grilled food, or any meat that is rich in saturated oil, such as mutton, beef, chicken drumstick, and as well as perhaps even curry or other kinds of animal fats. I think if a person is experiencing chest discomfort, which mimics a heart attack or suggestive of heart attack, the important thing is get urgent medical attention. So if a passerby encounters this patient, firstly try to contact the ambulance or emergency medical service as soon as possible. If a patient already has known coronary artery disease, where they have stable ischemic heart disease, perhaps they may have some medication with them. Medication like aspirin, which will thin the blood, or other medications such as nitrates, what we call nitroglycerin, which will come in the form of a spray or a small tablet that placed under their tongue. What this does is that it actually helps the blood vessel dilate a little, so that it just allows a little bit more blood to pass through the blockage. And this can sometimes ease the discomfort and protect the heart. Obviously, if a patient is found to have a massive heart attack with an irregular heart rhythm that actually becomes unconscious, then if possible, the passerby should institute basic cardiopulmonary resuscitation or basic CPR if they have been properly trained in it. In general, I think it's important for all our patients or all individuals to recognize their own risk for heart disease. So especially to reduce the risk of heart attack, we have to quit smoking if they do. Again, do exercise regularly and have a good and healthy diet. Recognize their own risk factors, especially if they do have high blood pressure, high cholesterol or diabetes, because these are factors that they can modify in their own life to try to minimize the risk of a future cardiac event.